Is prediabetes a stroke risk factor? Imagine a warning sign on the road that's not quite a stop sign but still signals caution. That's similar to what prediabetes represents in our bodies. It's a condition where blood sugar levels are higher than normal but not yet high enough to be called diabetes. This state of impaired glucose regulation is important because it can increase the risk of stroke, especially ischemic stroke, which happens when blood flow to the brain is blocked. Research shows that people with prediabetes have a modest but meaningful increase in stroke risk compared to those with normal blood sugar levels. For example, studies have found that prediabetes can raise the chance of having a stroke by about 19%, especially in people who also have other risk factors like atrial fibrillation, a type of irregular heartbeat. This suggests that prediabetes can independently contribute to stroke risk, even if other factors are controlled. It's important to understand that the risk associated with prediabetes is considered intermediate. People with diabetes, which is a more advanced state of blood sugar problems, have 2 to 3 times higher risk of stroke. Prediabetes, while not as risky as full-blown diabetes, still increases the chance of stroke, making it a warning sign that shouldn't be ignored. The connection between blood sugar and stroke involves how the body handles glucose. Both fasting blood sugar and the blood sugar level after a glucose load are linked to stroke risk. Interestingly, post-load glucose levels, measured to hours after drinking a sugary solution, might be a stronger predictor of stroke than fasting levels. This highlights how abnormalities in glucose metabolism can influence blood vessels and brain health. Other factors often found alongside prediabetes, like high blood pressure, obesity, and atherosclerosis, can further raise stroke risk. Even after adjusting for these conditions, research shows that prediabetes itself still has an independent effect on increasing stroke risk. Some studies suggest that the risk is particularly higher in people without hypertension, indicating that the interaction between blood pressure and blood sugar levels can influence overall risk. From a prevention standpoint, recognizing prediabetes as a stroke risk factor emphasizes the importance of early lifestyle changes and medical management. Improving diet, increasing physical activity, and controlling blood pressure and cholesterol can all help reduce the risk of stroke in people with prediabetes. Screening for prediabetes in at-risk populations allows for earlier intervention, which can make a real difference in preventing strokes down the line. In summary, prediabetes is more than just a warning sign for diabetes. It's also a significant factor in stroke risk. Addressing it early through lifestyle and medical strategies is key to lowering the chances of having a stroke. Always remember, individual risk varies, so it's best to work with healthcare professionals to develop a personalized plan that fits your health needs.